In this video, we will discuss instrumental delivery and their indication contraindications. So there are two instruments, VENTOUSE and Forceps. Let's see the indications of them at first. So indication can be memorized by the mnemonic A, B, C, D and E. So A stands for arrest or prolongation, arrest or prolonged second stage of labor. So it is 3 hours or more in primary patient, and it is 2 hours or more in multigravida. And if epidural is used, we should add 1 hour to both of them. So this is without epidural. And with epidural, it will be more than 4 hours in primary and more than 3 hours in multigravida with epidural anesthesia. So A for arrest, B for when the baby is being compromised or there is fetal distress. B for baby. Baby indication is when the baby has distress, baby's FHR is dipping or so second indication is fetal distress. C stands for cardiac diseases. In the cardiac disease of mother, we will try to cut short the second stage of labor so as to decrease the chances of cardiac failure. D stands for distress. Again, this is the same, fetal distress. And E stands for exhaustion of the mother, when the mother is exhausted. So these are the indications of instrumental delivery. So what are the contraindications of instrumental delivery? So contraindications can also be memorized by the same mnemonic A, B, C, D. A stands for age. When the baby is premature, that is when the gestational age is less than 34 weeks, vacuum is contraindicated. B for when the baby has bleeding diastasis, bleeding disorders, when the presentation is bro presentation and also mento-posterior presentation. Instrumental delivery is contraindication. They land in cesarean section. C for cephalopelvic disproportion, and when there is caput on the scalp, that is holding is more than grade 3. And D for any demineralization disease. Demineralization disorder, that means something skeletal abnormality like osteogenesis imperfecta, like some brain disorders like intracranial hemorrhage and all. So these are the contraindications of instrumental delivery. So what are the prerequisites of instrumental delivery? So prerequisite of instrumental delivery, we can learn them by the mnemonic. Prerequisites of instrumental delivery can be learned by the mnemonic forceps itself. F for favorable position. The favorable position is occipito anterior, occipito posterior, that is vertex presentation. O for os fully dilated is favorable, but in case of vertex it is okay if os is more than 6 cm dilated. So this is for VENTOUSE delivery. F for favorable position, O for os should be fully dilated, R for membrane should be ruptured, and R for also head should be rotated. C for consent should be taken by the patient and their guardian. Cephalopelvic disproportion should be ruled out, and there should be good uterine contractions. E stands for engaged head. Head should be engaged. bladder should be empty. Episiotomy should be given, but it's not a routine. It's SOS, not mandatory. And E for the operator, the birth attendant should be skilled, that is experienced. P for pelvis should be adequate, and S for station should be favorable. It should be more than 2 plus favorably. It can also be applied after 0 station. So this is the forceps of instrumental delivery. Now let's compare forceps and vacuum in short. Vacuum now we use elastic cups, that is soft and made of plastic. So there are two types of elastic cups. One is bell shaped and the other is mushroom shaped. Bell shaped cup and mushroom shaped cup. The diameter being 5 to 6 centimeter. Where do we apply vacuum? So suppose this is fetal head, this is anterior fontanelle, this is posterior fontanelle, and there is a flexion point on this sagittal suture. This is flexion point where the center of the cup should lie. Suppose this is cup of the vacuum. The posterior fontanelle should touch the rim of the vacuum cup. The flexion point should lie 6 centimeter posterior to anterior fontanelle and 3 centimeter anterior to posterior fontanelle. So this is the ideal flexion point, and the pressure generated should be, initial pressure should be 0.2 kg per centimeter square per minute, and it should be stepped up like पहले 0.2, फिर 0.4, 0.6, then 0.8 centimeter, 0.8 kg per centimeter square. But अब ऐसा नहीं करते, अब सीधे 0.8 centimeter का प्रेशर देते हैं. Now the machine delivers 0.8 kg per centimeter square within 2 minutes only. So this is the initial pressure now. So this is something about vacuum. Now forceps. We have 3 or 4 type of forceps, but not used now. Now let's discuss something about forceps. Forceps can be outlet forceps, they can be low forceps, they can be mid cavity, there can be high forceps. Mid cavity and high forceps are not used now. Now we use only outlet and sometimes low forceps. The example of outlet forceps are Simpson's forceps and Wrigley's forceps. Low forceps example is Das forceps, and most of the forceps are low forceps indeed. Mid cavity forceps and high forceps are outdated and not used now. Mid cavity स्टेशन 0 एंड +1 में करते थे, हाई फॉरसेप्स +0 स्टेशन से अंदर में करते थे. लो फॉरसेप्स इज यूज्ड when the station is more than 2 plus, and outlet forceps is used when scalp is visible at introitus, head is at perineum, and sagittal suture lies in anteroposterior diameter with deviation of not more than 45 degree. मतलब this is fetal skull, this is sagittal suture. So sagittal suture should lie in anteroposterior diameter with deviation of not more than 45 degree. So the ideal favorable position should be direct occipito anterior, direct occipito posterior, or right oblique or left oblique. So suppose this is forceps. Forceps has a shank with variable length. Shank gives the length to forceps. So sometimes in Wrigley's forceps ये length बहुत छोटा होता है, and in Keelan forceps and Piper's forceps ये length बहुत लंबा होता है. So this is shank, this is handle, and this is blade. यहाँ पे lock होता है, this is lock, this is blade. Blade has cephalic curve and blade has pelvic curve. अगर साइड से देखेंगे तो pelvic curve is this thickness, this is pelvic curve, and pelvic curve should always point upward. So this is forceps. Some special forceps are keel end forceps. Keel end is rotational forceps. Piper forceps we have. Piper is for breech, after coming head of the breech. Mostly we use touch forceps. This is low forceps, and outlet forceps is release forceps. So let's discuss how we apply forceps, in which direction. So the direction of the patient should be in lithotomy position. Suppose this is a table, the patient is in lithotomy position. Direction of pull is asked. If we are the direction is decided on the base with regard to the mother abdomen. So ये हो गया मदर के लिए ऊपर है, दिस इज अपवर्ड. मदर के लिए नीचे है, दिस इज डाउनवर्ड. दिस इज मदर के ऊपर है तो फॉरवर्ड, मदर के नीचे है तो बैकवर्ड. सो द डायरेक्शन इज with regard to the mother abdomen. So if we are applying low forceps and if we are applying outlet forceps, the direction differs. In the low forceps, the head is at more than +2 station. So the direction of pull will be, first direction will be downward and backward. Then it would be downward, then it would be downward and forward. So in low forceps, the first direction of pull will be downward and backward, then downward and forward. But if we are applying outlet forceps, the head is already at perineum. We don't need to pull downward and backward. So here the first direction of pull will be downward only, and then downward and forward. Now let's compare vacuum and forceps, which to select and which to not. Vacuum causes fetal injury, fetal head injury more, and forceps causes maternal injury more. But still, some injuries are specific to vacuum and some injuries are specific to mother. For example, cranial nerve 6 palsy is most commonly seen in vacuum. Cranial nerve 7 palsy, F for facial nerve. Cranial nerve 7 palsy is seen mostly in forceps. Also, brachial plexus injury is more specific. For forceps, convulsions are more specific in forceps. Intracranial hemorrhage, subarachnoid hemorrhage, depressed skull fracture are more specific for forceps delivery. Whereas 6th nerve palsy, shoulder dystocia, retinal hemorrhage, and cephalohematoma, these are more specific for vacuum delivery. Now let's see contraindication and indication of vacuum and forceps. Even if cervix is not fully dilated, we can use VENTOUSE. So even if the cervix is not fully dilated, at least 6 cm of cervical dilatation is prerequisite for VENTOUSE delivery. So even when the cervix is not fully dilated, even when the head is not rotated, we can use VENTOUSE here, but we cannot use forceps here. Forceps needs full cervical dilatation, and forceps needs fully rotated head. VENTOUSE से हम लोग थोड़ा बहुत रोटेशन कर सकते हैं. In case of face presentation, like mento anterior presentation, VENTOUSE is not used. VENTOUSE is contraindicated. In case of breech presentation, it is after coming head of breech, VENTOUSE is contraindicated. In case of preterm baby, VENTOUSE is contraindicated. In case of IUD, VENTOUSE is contraindicated. So VENTOUSE can only be used in vertex. V for VENTOUSE, V for vertex. We can use VENTOUSE only in vertex position, be it occipito-anterior, occipito-posterior, or occipito-transverse. We can use VENTOUSE only in vertex position, but we can use forceps in after coming head of breech with a special forceps, Piper forceps. We can use in face presentation also, in vento anterior. We can use in preterm baby also. So we will prefer forceps delivery for cardiac patients. In case of heart disease, forceps is selected for cutting down the second stage of labor.